so a lot of complications. So then this one also a friend's, Dr. Brian, my partner, my colleague's case. You see, the smile like this. If you smile like this, you wouldn't dare to open your mouth, right? No wonder people will smile like this, right? And then doesn't look, why do you? No, if you smile to me like this, I will think, do I smell or not? Or something wrong with me or not, right? So we want to make the smile nice, like this. How much does it cost? This one is in the general hospital, so not so much. Yeah, you have to wait your queue. So inside the mouth looks like this one. You see this one, a lot of build up that the bite has, we called it collapse. The bite has collapsed. So the teeth are meeting, the upper jaw and lower jaw meet too closely. And then there is erosion, I think root canal, a lot of money. So this is after, see, a lot of work. So teeth are so important. And then this one, this is my cousin. My cousin is also a dentist. So you see, when you don't have teeth, your face will become short, like, you see, like old people, because no teeth. So the upper jaw and lower jaw meet very closely. But after build up, see, the chin has support already. You see this, you can see the support there. So if you look inside, it's like that, no teeth. Only bone left, and bone usually will resorb. It will become shorter and shorter and shorter. That's why when you have denture, usually every 5 years you have to change your denture, because your bone will change and then the denture becomes loose. Then you have to change your denture, and then you have to keep on changing denture. And with this type of a full denture, very difficult. I find it very difficult to do. You see, your denture is almost like floating in the gum, on the gum. So very difficult to make it stable. So we have a specialist for this kind of dentistry, for denture, bridge and implants, all these. This kind of dental specialist is called prostodontist. They put denture, artificial prosthetics in your mouth, okay? See, before and after, when you don't have teeth and then when you build up, it's changed your face. It makes you look younger. So teeth are very important, but teeth are not the only important thing, because from teeth, it can lead to many, many things. One of the most common thing we have is bad breath. Halitosis, it's called halitosis, bad breath. Bad breath can be socially very awkward, very embarrassing, and it can be caused by many, many things. It's not just caries mean dental decay, or gum disease, or poor oral hygiene, Sometimes when you don't drink enough water, you will also have bad breath. And then if you have an illness, some disease in your mouth, like say if you have a tumor or ulcer or something in your mouth, also it will cause bad breath. Then when you eat, like if you eat chicken rice, durian, okay, you have bad breath. And then sometimes when your digestion is not good, you don't digest your food properly, or you have regurgitation, or the gut gastric reflux, it will also give you a smell. Or if you have kidney problem, ketoacidosis, so ketoacidosis will also give your mouth a kind of smell, something like a cologne smell. You think is like fragrant, but after a while it becomes very smelly. So there is a kidney problem, or if you smoke, or if you take certain kind of medicine, you also smell. So that is halitosis. Dental disease also will result in halitosis. Then, if you have poor oral hygiene, this is your teeth, then you have the plaque. When you have the plaque, that means your food is there, and then the bacteria come and set in, then there is plaque here. It will cause inflammation of your gum. When it causes inflammation of your gum, the blood vessels around that area will become, the permeability of the blood vessels increase. That means the blood vessels, the blood vessels becomes a very leaking. It's like leaky blood vessels. Then the bacteria it will go into your blood. Then it will go to many other parts of your body. One thing is it goes to the brain. It may go to the blood vessels that already have plug in your blood vessels, or if you have a crack in your blood vessels, then this bacteria tends to lodge onto the crack. Or if for people who have a pacemaker or who have done heart surgery before, you have scar in your heart or in your blood vessels, then this bacteria will lodge onto that, start to grow, then you will have a lot of problem. You have carditis, you have a lot of problem, very life-threatening problem, yeah? So this is what, from the dental, from the teeth, this is what that can happen. Even to the brain, yeah? You see, even to the brain, they found out that people with poor oral hygiene, with gum inflammation, and tends to get dementia earlier, especially Alzheimer's. There's this amyloid protein tends to build up earlier in your brain. And then in some studies, they found out that in an Alzheimer patient, they found oral bacteria in the brain. And then gum problem also, of course, it will cause a lot of gum problem, and the gum problem, the bacteria may get into your blood, then you have a systemic inflammation. And then some of them will get into your lungs, and you tend to get pneumonia. And then sepsis means you have the bacteria all over your body, you have fever, but most of the people, they overlook that is maybe from the mouth. Yeah, and then some are like negative effects on pregnancy as well, because mother and the baby is connected. The bacteria in the mom can go to the baby. So if mom has very poor oral hygiene, the bacteria may go to the baby. In the future, the baby may tend to get caries easier. Yeah, so I've seen one case like that. So the mother tends to get caries, and then one of the children also always get caries. And then infection of the chest, heart problem, which is very common. And if you already have osteoporosis and your oral hygiene is not good, you tend to lose bone more easily in your mouth. So your teeth will lose the support. Yeah. And then diabetes. I will show you one case of diabetic one. When you have diabetes, that means your blood has a lot of sugar, and you have infection in the mouth. The infection will heal very poorly, and then it will spread. You don't have the good defense system to prevent it from spreading also. So it's, when you have dysbiosis of the mouth, that means the bacteria in your mouth is not balanced. You have more bad bacteria than the good bacteria. It may affect your brain, it may affect your artery, it may even affect your gut system. Yeah, you have chronic inflammation, then you have impaired because your neurotransmitters is produced in the gut, right? And then your liver, and also it may cause obesity. So we have to remember that mouth is part of the digestive system. It's an extension of our gut, So whatever happened to the gut when you have dysbiosis, it can happen when your mouth have dysbiosis also. And even in children, they found out that children with poor oral hygiene, usually their brain, because there is a membrane that protects the brain. When you have inflammation in your body, the membrane becomes very permeable. So the permeability of the blood-brain barrier becomes less. So anything can just cross into the brain. So you have brain fog. So you scold your son, you cannot concentrate. How come you cannot concentrate? Always daydreaming, right? So maybe it's not his fault, yeah? And then it will affect their indigestion as well, their microbiome in the gut. And that's why some children, they cannot learn well because they cannot focus. And then some children, they are stunted. The growth may be stunted. All can come from your oral hygiene. Yeah, so oral hygiene is very important. Sometimes we see this in the mouth. When you see this in the mouth, your enamel. Enamel is the strongest part of the body, the hardest part of the body. And yet it can be worn out like this. So the first thing I ask is, do you drink fizzy drink a lot? You drink Coke a lot or not? You drink what else? Whatever is in the can, because there is bicarbonate acid. Acid can wear down your teeth like that. The second thing we have to suspect is gastric reflux. So gastric is very acidic. So you always regurgitate from your stomach. Yeah. So it will wash your enamel. Becomes like that also. So it has digestion problem as well, yeah. Sometimes it's the dentist who discover it first, right? And then this all costs money, because you have to build up your teeth, you have to do surgery, you have to do a lot of things, yeah. It costs money. Money goes away. So now, tonight, you are very lucky because you are here. We are going to teach you how to save some of the money, okay? So you know what causes all these problems? We need to understand the teeth first, so then you can appreciate how to solve the problem. The teeth, the enamel is the strongest, not the strongest, sorry, the hardest part of the body. It's harder than the bone. Okay, you can only cut the enamel with diamond, and also with very high speed rotation or with acid. And then this is the dentine part, which is a lot of nerve there. This is a sensitive part. And then inside there, this is a chamber. We call it pulp cavity. Yeah? Inside the pulp cavity is where the blood vessels and the nerves are. This, where there is blood supply and nerve alive in this chamber, that means the tooth is alive. When this nerve dies or the blood supply is cut off, the blood doesn't come into the chamber anymore, the tooth will not have blood supply, then this tooth will turn black. On the outside, it will look like it's black and dark. Yeah? And then you can see that the tooth is inside the socket. The socket is covered, lined by this gingiva, ligament and all that. And then there is this bone. This is the bone holding the tooth. Then you can see the nerve and the blood vessels actually come to blood vessels here. Blood vessels and nerve here. And these blood vessels and nerve actually goes to the brain, goes to the body. Okay, now you understand that, then we will see how we can help to solve the problem. The most part, when you lose your teeth, when you need to do build up, when you have crowding in certain cases, it is because of you lose your teeth. Yeah. So there are two reasons why you have all these problems. One is intrinsic. That means it's in the gene. You are born with that. Like if you are born with long jaw, or you are born with less teeth, or extra tooth, or embedded tooth. This is something that, or maybe some people, they have defective enamel. So these are born. We cannot change it. No choice. You have to ask your parents to work harder, make more money, so that you have to do. You have to save the money as much as like a Honda CR-V. To fix all that problem. But most of the time, the reasons of that problem, like you lose a teeth, you need to do root canal, you need to do bridge and all that, is something that we can control. Something is environment we can control. So we are looking, this one we cannot do anything, we don't do anything. Yeah, we just make sure we have enough money. Okay, that one we can do something, then we will do something. Okay, so what are the things? First thing is a dental decay. How does it form? See, this is a healthy tooth, and then after you eat, you don't brush your teeth, then your plaque will start to form. Plaque forms within 6 hours. So you cannot like, I eat now, tomorrow only I brush too late. So it's better if you can, if you really rajin, brush every time after you eat. But it forms in 6 hours. Then if you leave it for too long, the bacteria have a party with your plaque, and then they will start to eat the plaque, eat everything there, and then they will start to produce their, they will pangsai, they will pass things out also. And the things that they pass out is very acidic. So they will pass out acid, they'll lower the pH, and therefore, because of the acidic environment, your calcium, you start to lose out the calcium and phosphate, and then you start to have cavity. This is why you have cavity, and if you some people are like that. They are so phobia of dentist, of dental chair, or the sound, like that, yeah? So they postpone until they feel the pain. When you feel the pain, most of the time is root canal already. I mean, if you need to do root canal, maybe if you find a specialist to do for you, 5,000, 7,000 ringgit lah. So very expensive, right? So better cut the nip. Cut the what at the nip, stop it before it is too late, right? And if you leave it for too long, then you may lose the teeth also, because it's too. So this is the progress of how you get the dental cavity. And then another problem, this is how the dental cavity looks like. It's like you have a dead tissues inside your mouth, and then you see, if you have a teeth like this cavity, do you dare to smile? That's why you will smile like this, or then the people think that you are not friendly. You don't show them your heart, right? So people think that, oh, you don't like me. That's why you talk to me like that, So you don't smile. Then some of the cavity you cannot see. You need, because it's at the side, you cannot see from the top. So the dentist may even miss it. You need sometimes an X-ray to check. Yeah. So this is what happens. patient, yeah, last time when I was younger, I now only do braces, but last time I see all sort of cases. They will say, I have a ngapok, you know. And they think this ngapok will come and go. So I just leave it for a while and it will go. But you know what is this ngapok or not? This is pus, nana, nong, pus. So you don't leave your nana there, because if you look at the x-ray, this is a cavity here, and that you see the dark area here, this is the nana, and the pus. And where is the pus? It's very near to the blood vessels. So the infection can get into your blood and then go everywhere else. Yeah. So you don't want the infection to spread. So better stop it before it goes until there, right? When you have the ngapok and you have the x-ray like this, definitely, for sure, you have to do root canal. And most of the time when you do root canal, you want to save the tooth, right? You don't want to take the tooth away. Yeah, we want to save the tooth. So you do root canal. Usually after doing root canal, the tooth becomes more brittle. So you protect it with a crown. So you do root canal, maybe 5,000 ringgit, depending on what tooth. If it's a molar, usually maybe more. And then you do a crown. I don't know how much is a crown. How much is a crown now? 2,000-3,000 ringgit. So one tooth will maybe cost you close to 10,000 ringgit. Sell your LV bag. Okay? And in children, if you don't do anything, you see the infection spread like that, go to the sinus, then you have odontogenic sinusitis. That means your sinusitis, your infection in the nose come from the teeth. And then this one is the infection on the here. We call it Ludwig's angina. This one can be very dangerous, you know. It can block the airway. So especially if your kids have asthma, this can cost the life. So very careful. Then if the tooth is infected, extract lah, baby tooth only, never mind lah, extract. So what happened if you extract a baby tooth? Yeah, this is what happened. The baby tooth is gone, so the neighbor tooth lean in, so block the way for this one, you become crowded. So what happened when you are crowded? Come and see me, I charge you 10,000 ringgit. Anyway, I win. Okay, now another problem that cause all these dental, health, oral health, is your gum problem. So if you don't, this is healthy gum. This is healthy gum. How do you know this is healthy gum? It's sharp, and then it looks pale pink. This is healthy. The gum is supposed to be sharp. Yeah, rarely in Malaysia I see anyone with gum like this. Very rare. So this is healthy gum. And then if you don't brush your teeth after eating, you wait for more than 6 hours, you start to have plaques. Usually the plaques will be near the gum. Yeah, that is where the bacteria likes to hide also lah, yeah. Then when there is plaque there, your gum becomes inflamed. Inflamed means it's red, it's swollen, it bleeds easily. Sometimes it can even be painful in the gum. And then this is inflamed gum. You can see the plaque here. Then you can see that this tooth is also starting to decay. There is white patches. That means it's starting to lose calcium. So this tooth is also starting to decay. Then you can see plaque, yeah, and gingivitis. Then it goes to the next stage. But if you don't do anything, after gingivitis, after the inflammation of the gum, you don't do anything, the gum will detach from the tooth. It starts to come away from the tooth. Yeah. So when it starts to come away from the tooth, you can put things inside. You can put the probe inside and you can feel that. You can see that you can put the probe inside because it's come away from the tooth already. It can go deeper and deeper. So that means more and more defense system cells, your immune cells will be sent to that area because there is a lot of plaque. Plaque is foreign body. Then a lot of foreign cells will go to this area. Your body will send all the immune cells to here because they try to fight away the plaque. Of course, they cannot. So what happened? They will attack your bone and then they will produce a biochemical substance that will also cause your bone to resorb. So you start to lose your bone. See, you start to lose your bone. So when you lose your bone to a certain stage, we call the stage 4. Stage 4 means the bone is really you lose a lot of bone already. You can even see the root already. And if you leave it for too long, one day you wake up, you'll see, hey, my tooth is on the pillow. I have a friend, I have two. One is like, she said, oh, the next day she woke up, the tooth is on the pillow, no painful extraction, free extraction, the tooth just fall out. The other one is when he was eating the food, the tooth is at the table dinner, the tooth fall out. Because the bone cannot support the tooth anymore because of inflammation that caused to bone loss. So this is how you get your problem. So when you lose teeth, what do? You either do implant if you have enough bone. If you don't have enough bone, then you'll put bone graft, cost you a lot of money. And then or you do crown or bridges, all these cost money. So what do the dentists do? If you have a lot of plaque, they will cut your gum and then they will clean underneath clean underneath. This is a small thing already. So this is actually my patient. That's why this patient went to a dentist to do braces, and she is diabetic. When anyone with diabetes, usually their healing power is not so good. They're healing very slow, take a long time, and then sometimes cannot even heal properly. So, and then if you are diabetic and your oral hygiene is bad, wow, your inflammation, your gingivitis will progress very fast. The infection, the bacteria will be having a party in your mouth. So she went because her bone is resorbed so much. This particular tooth, no bone support. So the tooth drift forward. And she went to a dentist. The dentist diagnosed it as, teeth jutting out, class 2 in malocclusion. That means, jutting out teeth, like crowding. So what did she do? She extract the good tooth here, put braces and try to bring in this tooth. Then when this girl came to me with the braces in the mouth, we took an x-ray. That tooth is actually hanging in the gum, no bone. You cannot move the tooth anymore. I told her, this tooth is going to come out. We just use the braces to hold it there only. When we remove the braces, this tooth, you are going to drop. Eventually, she lost a tooth. She need to do a denture there. It's too expensive to do anything else. Anyway, she doesn't have bone there. So, even if you want to do implant, you have to consider properly because there's no bone. You may want to do bone graft. The bone graft may not work because she has diabetes. Her healing power is not so good. So, a lot of problem. So this is when you lose your teeth. So this is what you need to do. And this is a gum progress from healthy to gingivitis to when the teeth, the gum start to detach from your teeth and then you start to lose the bone. Bacteria usually like to hide under the gum, subgingivally, under the gum, under the gum and in your tongue. So remember to brush your tongue also, very important. And not all gingivitis, not all gum problem are the same. Pregnant mother, if like say for example, you are in gingivitis, the second stage, like you only have gingivitis. For normal people, maybe the gum just inflame. But in pregnant mothers, sometimes the reaction is like very much, like suddenly a big swelling there. So mothers also, you must keep your teeth very healthy, especially keep your gum very clean. Not only for your own health, because your gum actually react more when your hormonal is fluctuating, but also for the baby, because we don't want the baby to get all these bacteria. Next time the baby will tend to get tooth decay easily. And then if some people who take medicine also will have gingivitis like this, swelling, abnormal. You can tell this is not normal gingivitis. So these are when they take medicine like some certain anti-hypertensive medicine or anti-epilepsy medicine, they will have this kind of hyperplasia. Or sometimes cancer also comes like that. When I was a young dentist in Alostar Hospital, one day this prisoner guard brought a prisoner into the dental clinic. He brought this prisoner into the clinic and then they say, he has very bad gingivitis, swelling gum. So ask us to do cleaning. But when we look at the gum, we say better do a blood test first. So we did the blood test. A few days, it takes very fast. The lab called us and the pathology lab, this patient must ask him to be admitted quickly. So we called the prisoner. We found out he has leukemia. Megaloblast, something like that, the one kind of leukemia, blood cancer. So like this. And so we called the prison and asked the prisoner guard to bring this prisoner in. He came into the hospital. The next day he passed away already. And then the prisoner said, luckily, you diagnosed and we brought him into the hospital and he died in the hospital. If he had died in a prison, wow, a lot of investigation already. What happened, blah, blah, blah. You know, they have a lot of things to answer to. So that is gingivitis. Like, it looks like you will think that it is like maybe just gingivitis, but there's medical thing. Sometimes, like for example, this prisoner case, the disease is discovered by the dentist. Not the doctor. Most people come to the dentist first. But if it's leukemia, it comes with something else. It comes with fever. You will have fever on and off, won't go away. And you will have bruises. You have bruises very easily. But then you suspect, sometimes bruises, you're like, I knock, you won't really think of it. And fever, you will think that maybe, now influenza and all that. But then when you see gum like this, you'll go to the dentist. So dentist see it first. So what can we do? Now you know that how you get the problem, mostly because of the bacteria, the plaque and the gingivitis. Then what can we do? First of all, blister. We have to prevent with blister. So visit your dentist regularly. Better visit every 6 months. Sometimes some of the patients, when their oral hygiene is really very bad, I will ask them to come back every 4 months. And then for children, you ask them to you bring your child. If you have little kids, bring them to the dentist as soon as possible. As soon as they have the first tooth. They may not need treatment, but so that's why when we want our mouth to be healthy, not just teeth, our mouth to be healthy, don't wait until there's a problem, then only you go and see dentist. Even before you have problem, check up regularly every 6 months if your oral hygiene is good. Not every 4 months if our oral hygiene is not good. I have some patients, I educate them. I use Glister to educate them. I teach them how to brush. I teach them how to use Glister toothpaste. I teach them how to do mouthwash, all with Glister, and they buy Glister from me. They keep their oral hygiene so well, I will tell them, oh, you can come every once a year. It depends. But if you bring your kids to the dentist, even before they have toothache and all that, they go to the dental clinic, they think dental clinic is playground. Then you have you have an easier time when they need dental treatment. They come, they get familiarized with the dental clinic, they get familiarized with the dentist, may become good friend with the dentist. So then they will know how to appreciate their teeth, they will take care. And if they need filling and all that, you won't have sometimes I have met kids who are so difficult to control. We need the mother to sit on the chair, the children to sit on the chair while you have to wrestle. When I was a general dentist in Penang Adventist Hospital many years ago, there's this boy, he's already, I think he was 10 or 12, something like that. You have to, the father have to hold him. He's very strong, the father have to hold him while it's like fighting like that, like wrestling like that. And then another boy, you have to pujo him. Wah, abang pandai abang. Wah, you have to pujo until, but it's a lot of fun actually. So visit. So dental care is step 1, 2, 3, very easy. Step 1 is brush your teeth. Brushing teeth at least twice a day, if you can, every time after you eat. Then use a good toothpaste. We'll talk about that later. And then at least for 2 minutes. Don't like, okay, brush already, that's it. So do it properly. Then after you brush, do not rinse. Spit out your saliva, spit out your toothpaste. Wait for 1 or 2 minutes because we want the ingredient in the toothpaste to work. You have fluoride in the toothpaste to remineralize. We have Glister, have probiotic in the toothpaste. We want it to work. We want it to balance out, to provide good bacteria. We don't use antibacterial because some of the bacteria are good in the mouth. Some of the bacteria actually help digestion. So we want that, so you leave it there for 1 or 2 minutes. While you see our toothpaste are one thing very amazing. Of course, it does many things that other toothpaste also do, But ours one, we have this fluoride. Many toothpaste also have fluoride, but we have this formulation that is very effective in replacing your calcium. What does fluoride do? When your tooth lose calcium, it's called demineralization. You lose calcium. the fluoride remineralized. It replaced the calcium. That means you already lost the calcium, so they replace the calcium. So then you don't have the decay. But what I like most is the probiotic in the toothpaste. They provide good bacteria, so they control the good bacteria. When you have more good bacteria in your mouth, bad bacteria even before you lose the calcium. Yeah. So, but then the thing is, you must also remove the plaque. It doesn't mean that, okay, I put a lot of blister in my mouth, no need to do scaling, cannot. You must remove that factor also. And then it's very low abrasion. It's very smooth. It's smoother than another B brand. Last time there's this OB brand, gel form, very low abrasion index. I tested it with our Glister, not the new one. The new one is even more smoother. I tested it with the old formulation, which is less smoother than this one, less smooth than this one. It's even the old one is smoother than that smooth X brand, So it's it doesn't scratch, cause abrasion in your enamel, And then now it's all plant, environmental friendly, and all. Then there is mint. We have the mint, or we have the mint ones, or the white tea one. I suppose white tea also have a good antioxidant. So I like to introduce the green type. One is with white tea. I like to introduce the white tea one with to smokers. This one is a minty smell. Whatever it is, our toothpaste, the mint or the white tea, they have birth certificate. If anything, you can go to that tree in that soil to find out what is wrong, what has gone wrong. They have birth certificate. You can find it. You can trace the plant. So then toothbrush. Our toothbrush is of course a lot very good. Now the toothbrush can bend. Sometimes you want to reach certain area, you can bend. Some people are very strong like that. So when they brush too strong, you see it will also bend. So it will make it not so, it will not hurt the gum, and then the back of the toothbrush is for you to brush your tongue. Don't use tongue scraper, that is too harsh. You will scrape away your taste bud also, So you use the back of the toothbrush to brush your tongue. And this toothbrush is very dense, so you cannot miss any surface, it's very dense. And then the way to brush is like you need 45 degrees to the gum. You 45 degrees to your gum, okay? 45 degrees to the gum. You remember the bacteria likes to hide under the gum, right? So tuck a little bit under the gum, rotate, and then pull it out, okay? Brush and air surfaces, and then the tip of the brush is a bit longer for you to go in between the teeth to kacau, to stir a little bit. And then after that, after you have brushed, spit out. Don't rinse this yet. Wait a little bit. While you're waiting, you can flossing. And now we have the electrical toothbrush. What are the advantages? You have 3 speeds, a slow, medium, and high speed, very, very fast. It can deliver 32,000 vibration. So it's cleaner because you can vibrate more. If you use your hand, can you do 32,000 vibration in 1 minute? Cannot, you see. So you can use the electrical toothbrush. This is one thing. Another thing is very impressive. If children who don't like to brush teeth, brush already, right? 1 minute finish, or 1 second finish already. You use this electrical toothbrush. It has a timer. Once you turn it on, it will vibrate for 2 minutes. So they have to, if the 2 minutes is not up, they cannot stop. Okay, and then also, if once you charge, it can last you 70 days. So if you need to climb, you need to go into Taman Negara. Also, you can bring the electric toothbrush there. Okay. Then there are 5 modes. You can have the cleaning one is for you to brush. Sensitive is slower, gentler. So for if you have sensitive teeth, I like the gum care. Actually, so you can put it over your gum near the teeth there. Then you massage your gum. Very nice. I like it. It's really like you sit. You go to the airport, the massaging chair. It's like that feeling. Yeah. And then the whitening. whitening, I hardly use this one, but it is good because I forgot why it's good. But it can, because it can whiten your teeth. It can help to make the teeth whiter. Then the tongue part, you turn around the tooth. You need, see, this is my. So this it comes with three. You see three bits, and then this is the UV light. You put there, it will kill the germs. So you use the back of the toothbrush. You can brush your tongue. So tongue is very important. Okay, I am going to go a little bit fast. Right. Then you do your flossing. Okay, I show you how to floss. So after brushing, you spit out. And then while waiting, how do you floss? Your shoulder length. Your floss should be your shoulder width. And then you cut. You use short one. They cannot go to the back teeth. And then you hold one end with your thumb and the middle finger, the other end thumb and middle finger, and then you twirl around your middle finger. This is when your middle finger is of good use. Positive. Then you leave about 1 inch for control. You see, if you feel our floss is flat and waxed. Because when you go in, remember where the bacteria hides? In gum, under the gum. So you have to go under the gum. Don't push, but you must go under the gum, circular, come out. Then the plaque and the bacteria will come out. So you have to go under the gum. When you go to the, you can open up and then you can go in, you know. So you need this much. See, your 10 ringgit is worth it, right? You come. And then, so our floss is, of course, the most important thing is that flat ribbon, and then it is waxed, okay? So it doesn't cut the gum. And this is how you floss, I've just shown you. And then we need to rinse. After that, after you brush, wait a little bit, spit out, floss, and then only you rinse. And the way you rinse, you see, one thing good about our rinse is that it supports the oral microbiome. Very important. The ecology in our mouth, the bacteria balance is very important. So this we don't have antibacterial in the mouth rinse. This mouth rinse is also very important. It has the mint inside. And the way you rinse is you take this cup. Okay, I brought it also. Sorry, Thank you, Marcus. So you have this one, you put water, half the cup. Now, according to instruction, you need 5 pumps. I think 5 pumps is a lot. 3 pumps, 2 or 3 is enough already. So, cup, 2 or 3 pumps, and then you rinse all over your mouth through the teeth 1 minute. So not like, that's it. No difference. You go in and then go all over 1 minute, then you spit. You will see a lot of things coming out from your teeth. Thank you very much. Okay, and then we have this mouth spray for bad breath. So it also helps to balance. Streptococcus mutans is a bad bacteria. It's the bacteria that cause tooth decay and gum gingivitis. So it will remove, this one will help to remove. So it is also very good if you have mosquito bite, you can also spray on it, or when you have sore throat. You can, then there is this silica, the polishing agent that is very smooth. It doesn't scratch your teeth, so the abrasion index is very low. What I'm very impressed is that symbiosis. We have the good bacteria in our toothpaste, in our mouthwash, to help control the bad bacteria. So now, how about nutrition? How can we help our gum, our mouth health? So I want to tell you a little bit about Nutrilite. Nutrilite is organic and natural. We have our natural organic farm in North America and South America. We have more than 100 scientists in Nutrilite. I think you have known that. But Nutrilite has been putting in a lot of research and investment in probiotic research. That's why now you see we have toothpaste, everything probiotic, a lot of probiotic. Our Nutrilite also probiotic, female probiotic, and all that. And then Nutrilite also has invested in metabolic health and anti-aging. More than about 20 years ago, Nutrilite already started those research. So now you see we have this double X, we have omega-3, we have these are M-Cell, so M-Cell is very, very good. Unfortunately, not everyone can have it now yet. And then Nutrilite is also going into gene, your DNA. So so this is so like many years ago, I think more than 10 years, I don't know when, but definitely more than 10 years ago, Nutrilite invested more than 200 million US dollars in China to do some research in China. There is a book that is called Conundrum of Materia Medica, Compendium of Medica Medica. This is a herbal medicine book that has been existed since like 2,000 years ago. So Nutrilite is investigating the plants in that book and for many years. And then recently, they come out, the result is they come out with this M-Cell. So M-Cell is not just yesterday, the research has been going on for the past more than 10 years. Now only it came out, yeah. Another thing similar is like this, this our illuminating system. They start researching more than 10 years ago. Now only they launch. So Nutrilite Artistry Amway is not like, this thing works. Okay, we know, tomorrow we market it. Become year. You see this one, amazing or not? Me, that's me here. One day only, So I'm going to check again in 10 days, and then. But artistry, it should take 4 weeks to see effect. No, this is the illuminating system. M-Cell, yeah, but I think if we use with M-Cell, you'll see the effect even more. Not the same as X brand out there, yeah. So now we come to what are the supplements that is good for the bone and the teeth. First of all, of course, is calcium, magnesium, and D. D is very important because you need magnesium to absorb the calcium. You need the D to make sure that the calcium goes to the bone. All right. So when do you start? Pregnant mothers should start. Teeth are formed and bones are, of course, are formed when the baby are still in the womb. So you need to start. Mothers need to start calcium, magnesium, D even before the baby are born. Then teenagers also should start because especially girls, you need to carry a baby the next time when you are older. So when you are carrying a baby, the baby will take all the nutrients from your body. When you don't have enough nutrients in your body, they will go to your bone, they will take from your body, So we need to supplement girls when especially calcium, magnesium, D, this is something that girls need a lot during pregnancy, and if you don't have enough, you see that's why women tend to get osteoporosis. So you see, if you look at this curve, this one is head and brain, we ignore that, we look at the general one. When you're born, you grow, and then there's a slow down a bit, and then when you come to your growth spurt, your puberty, you grow again, and then when you come to your adulthood, it slows. This is the time when you need to get your calcium supplement. So about girls 12 years old. Okay, if you have girls, this is what you should do. And then for children, they are growing, they also need calcium. We have the calcium for children also. And then have the double X. Double X is the basic for everyone because you see there's D. D is very important. We need a lot of it, D, and then we have calcium, magnesium here also. The minerals are also very important, not for hormonal balancing, also your insulin resistance, chromium is very important. Then the gum, what do you need for gum? You need Bio-C, of course. Of course, in Nutrilite, Bio-C, vitamin C and X brand are not the same. I remember Dr. Ignatius told us, many years ago, vitamin C is actually a complex. It's not just ascorbic acid. It's ascorbic acid, factor P, biophenol plus this factor. It's a group of things. That is vitamin C. If you buy synthetic one, it's only ascorbic acid. Only ascorbic acid. But if you buy Nutrilite one, So vitamin C, according to Linus Pauling lived up to 93 years old. He's a scientist. He's got a Nobel Prize 2 times or something. He says vitamin C, you need more. Basic, if you look at RDA, you only need 70 milligrams. 70 milligrams is to prevent you from getting like scurvy or something. But if you want to be good, to be healthy, to have nice skin, nice gum, and all that, you need more than that. Especially us in Malaysia, weather is so hot, we sweat a lot, we urinate, we lose vitamin C very easily. Especially if you are stressful, then you lose vitamin C even faster. So you need a lot of vitamin C. So if you want to be healthy and live long life, vitamin C is very important, at least 3,200 milligrams. Another factor, if you want to live long and healthy, beside vitamin C, what is that? Huh? No. Is it? You're smiling. No, what is it? The right spouse. Marry the right person, then you live long and happy. If you marry the wrong person, I don't think you want to live longer also, right? So this is what he says. Okay. And then coenzyme Q10 is also very important for the gut.